Welcome to our Facebook Live, where UC Davis Mind Institute experts provide information about neurodevelopmental disabilities. I'm Marianne Sharp. Today, we'll be talking about autism in girls and women. Girls are diagnosed with autism far less often than boys are, but there are many questions about why that is. What does autism look like in girls? Are they more likely to mask or hide their autistic characteristics? What are the neurobiological sex differences? We'll be talking about all of this, and we'll learn more about a Mind Institute study that seeks to better understand autism in girls and women with our two guests today. Dr. Christine Wu Nordahl is a professor in the Department of Psychiatry and Behavioral Sciences and a Mind Institute faculty member. She is a neuroimaging expert and studies brain development in autism across the lifespan. Welcome, Dr. Nordahl.
Great to be here. Thanks, Marianne.
And Dr. Brianna Heath is the project manager for the Autism Phenome Project and the GAIN study, which we'll be talking about today. She's also the lead facilitator of NeuroTeens, which is a social support group for autistic girls and non-binary teens. Welcome, Dr. Heath.
Hi.
It's so great to have you both here. And if you have questions of our two experts, please do post them in the comments, and we will make sure to ask them and get them answered near the end of our discussion. So, according to federal data, boys are 4 times more likely to be diagnosed with autism than girls are. But the situation is likely much more complex than that statistic. So, what's really going on? What is the current thinking about how accurate that figure is, and what's happening with girls? Let's start with you, Dr. Nordahl.
Great, thanks, Marianne. So it's true that right now, boys are diagnosed 4 times more often than girls right now. And there is some thought that maybe that ratio is a little bit exaggerated. Maybe it's not exactly a 4-to-1 ratio of boys to girls who have autism. There's some evidence from population-based studies that it's maybe more like 3-to-1 or 2-to-1. But I think that there still is a real skew in that there are more boys diagnosed with autism than girls. We just don't know the exact ratio yet. And the evidence right now suggests that there are multiple factors involved in this skewed ratio. One line of research supports what's known as the female protective effect. And this is a theory that suggests that there is something about the biology of being female that makes them less likely to be autistic. Somehow it's shielding them from autism. And this theory really has support from genetic studies of autism. The flip side of this theory is that perhaps it's not only something protective in females, but maybe there's something about the biology of being male that makes them more susceptible to factors that lead to autism. And this is an area of research as well that's going on. But then there is this other sort of behavioral sort of reason why there is this skew in sex ratio. And I think this is the one that can actually be changing, whether it's a 4-to-1 ratio or a 3-to-1 or a 2-to-1 ratio. And this is the issue of diagnosis. And so there is evidence that girls may be going mis or under-identified, under-diagnosed with autism. And this is likely particularly true for girls who don't have language or other developmental delays, that really it's just autistic characteristics of social communication and repetitive behaviors. There's evidence that girls like this who have normal language, normal IQs, but have social communication challenges, they're less likely to be flagged and brought in for a clinical assessment, and therefore maybe don't get a diagnosis of autism, or maybe they're misdiagnosed with other conditions like anxiety or OCD. But I think critically, the consequence of this underdiagnosing or misdiagnosing of girls is that they miss out on receiving the support and services that could help them have a better quality of life. And so this is, there's 2 theories, biological and behavioral, that we really need to delve into more.
Yes, so many questions still to answer. So speaking of studies and research that needs to be done, most studies about autism do have far more male participants than female. How has this affected what we know and what we understand about autistic girls? Maybe start with you, Dr. Nordahl.
Sure. So most research samples just simply reflect this diagnostic bias and have at least 5 times as many boys as girls. So it's really not uncommon to see research studies that have fewer than 10 autistic females compared to dozens of autistic males in their samples. And this imbalance makes it really challenging to draw any conclusions, because if we see a difference in autistic boys that we don't see in autistic girls, we don't know if it's a true difference or if it's simply that we don't have enough girls in our sample to see the difference. There are studies now that are trying to reduce this imbalance, that are recruiting more autistic girls into their studies, so we can really look into this more.
Dr. Heath, anything you'd like to add on that one?
Yeah, so just we really want to have an understanding of all autism. So, it can look different across different individuals, it looks different in boys versus girls. And a lot of times there's autistic children who are getting left out of research. So girls, but also those with intellectual disability, those who are non-speaking or have behavioral challenges. And so to really include those children and their families in research, it's really critical to us to have studies that not only are including them, but to have protocols that are designed specifically to support their needs. And recognizing that, just there's different types of autism means there's also going to be different supports that we're needing to give families if we want them involved in research.
You just had the perfect segue to my next question, which was autism may look very different depending on the individual, regardless of biological sex. But are there any characteristics that we can point to that are more common differences between boys and girls? I know it's hard to generalize, but is there anything we can say or point to?
Yeah, so at this point, there actually have been several larger studies looking at behavioral differences between autistic boys and girls. And from these studies, there seems to be a finding that autistic girls may exhibit fewer repetitive behaviors than autistic boys. And there's also some evidence that they have fewer social communication challenges when they're younger, but they may have these changes may become more severe, more evident as they grow into adolescence. This is for autistic girls compared to autistic boys. But I think it's important to keep in mind here that a lot of the diagnostic assessments that we use today were developed primarily in autistic boys. Just like in all of the other research studies, girls were perhaps underrepresented in the studies that developed these tools. And so I think that's always important to keep in mind. But beyond looking at the core autistic characteristics, I think that there are some other striking differences that are really worth highlighting. So the first thing, and this sort of goes back to what I was saying before, is that when they're being diagnosed, girls are being diagnosed later than boys. So on average, girls are getting their autism diagnosis about 1.5 years after boys, so around the age of 7 compared to age 5 in boys. And again, this is just really important because autistic girls then are missing out on important opportunities for services and support. So that I think, and that evidence has come from multiple studies showing that girls are diagnosed later when they're diagnosed. This is not even talking about the girls who are being misdiagnosed or underdiagnosed. Another thing that I want to bring up that has also been replicated in several studies is that autistic girls and women have higher rates of attempted suicide. And this is obviously really important and critical to look into the risk factors for this and providing supports. But I just want to highlight a recent large study of over 6.5 million individuals in Denmark, 10 years or older, found that overall individuals with autism have a 3-fold higher rate of suicide attempts than non-autistic individuals. But within autistic individuals, the rate of suicide attempts in females was 4 times higher than in males. And so these are shocking statistics that we absolutely have to take action on and do something about, because we're just not helping enough in what we can do.
Yeah, that just illustrates how important it is that we understand what's going on. Can we talk about masking? There's a lot of evidence that some girls may be better at hiding or masking, sometimes called camouflaging, their autistic traits. What are some examples of what that looks like and maybe how common that behavior is? Should we start with you, Dr. Heath?
Yeah, so everyone masks. It's something everyone does. So if you think about how you speak or act at home when you're with your friends and family versus, if you're in a professional business meeting giving a presentation, you're going to act different in different settings. And so it's the same principle that occurs in autism. And so from a very young age, children are often taught how to act in a particular way that's hiding kind of the stigmatized behaviors, which in practice is basically how to act less autistic. And so that means, sometimes suppressing repetitive behaviors, or what's called stimming, pretending to follow along in a conversation. And so we see higher rates of this in autistic girls and non-binary individuals. It is really hard to quantify, though, because it's a very subjective experience. And so only the individual person can know how much they're, masking and how frequently. But we also think that, as Christine mentioned, or as Dr. Nordahl mentioned, that masking can sometimes contribute to girls being diagnosed less often. And some of those things that she mentioned, like having fewer repetitive behaviors or fewer social challenges, we don't know whether they're actually having fewer challenges or whether they're just masking it more than their male counterparts. But it also takes a lot of mental and emotional energy to mask. So if you think about, like I said, when you're in a business meeting, you're on and you're in presentation mode. And if you had to do that 24/7, that would be exhausting. So masking can result in these higher rates of things like anxiety, depression, what some autistics refer to as autistic burnout. And so some of these things, like she mentioned, social challenges may increase as they get older, can sometimes just be exhaustion of trying to mask that. But it's also meaning they're getting less support when they truly need it, because in order to hide autistic characteristics, they're essentially hiding what supports they need.
So masking is not benign in any way, is what you're saying.
No, it can be really difficult.
Anything you want to add on that one, Dr. Nordahl?
Yeah, and I will just add that there have been a couple studies out there looking at the neural basis of masking or camouflaging. And in these studies using neuroimaging, there have been some brain differences as well in how males and females, or what brain regions are associated with camouflaging or masking behavior in males and females. And so in a structural study, there's some evidence that there are parts of the left medial temporal lobe and the cerebellum that have shown associations with camouflaging scores in females, autistic females, but not in males. So this is suggesting that there's a different underlying brain biology that's supporting these different masking sort of behaviors that's different in males and females. And so I think that, whenever we can talk about biology underlying a behavior, it sort of gives us a target to work on and to understand better, and then to develop treatments and supports based on those things.
Yeah, and I know you're both involved in trying to find some of those answers. If you're just joining us, we are talking today about autism in girls and women. And coming up, we will be talking about a Mind Institute study that seeks to better understand the neurobiological characteristics of autism in girls and women. Our guests are Dr. Christine Wu Nordahl. She's a professor in the Department of Psychiatry and Behavioral Sciences and a Mind Institute faculty member. She is also a neuroimaging expert and studies brain development in autism across the lifespan. And Dr. Brianna Heath is the project manager for the Autism Phenome Project's GAIN study, which focuses on girls. Okay, we've been teasing this study. We better talk about it, huh? The Mind Institute is running this groundbreaking long-term study that seeks to identify subgroups of autism called the Autism Phenome Project. And Dr. Nordahl, you've been involved in that since the beginning. So this is over 15 years now. And you've created a separate study in conjunction with that that's focused on better understanding autism in girls. And we call that the GAIN study. What can you tell us about GAIN and why it's needed?
Thanks. So the Autism Phenome Project has been going on since 2006, and I was fortunate to be here from the very beginning, working on the Autism Phenome Project. And during the first 5-6 years of the Autism Phenome Project, we were just recruiting from the community as normal. And I started looking at brain differences between the autistic kids and non-autistic kids. And what I was finding, I would see brain differences in total brain volume or other things in the autistic boys compared to non-autistic boys. And then I would go and look in the girls and I wouldn't see that finding. And at the time, we had 180 autistic boys in the study, and we had 30 autistic girls in the study. So going back to what I was saying before, I see a brain difference in the boys. I don't see it in my 30 girls, but I don't know if that's because we simply don't have enough girls to actually detect that difference, or is it a real difference across boys and girls? And so in 2014, we launched the GAIN study, which stands for Girls with Autism, Imaging of Neurodevelopment. And the goal of this study was to specifically target more autistic females to enroll in the Autism Phenome Project so that we could reduce this imbalance in sample size and start looking for both similarities as well as differences across autistic boys and girls. And the beauty of this study is that it is longitudinal. And so we are studying brain and behavioral development from age 2, the earliest time of diagnosis, to up until adolescence. Our oldest kids in the project are in adolescence now. And so we're really getting a great comprehensive picture of what their life is like and what their brain is like as they're developing.
Since it is a longitudinal study, recruitment goes over a very long period of time. Dr. Heath, as I understand it, recruitment is currently going on. Who should be looking into signing up for GAIN? Who's eligible?
So for this study, for current phase, we are recruiting girls with and without autism. So you can kind of see the differences there. And we're looking for girls who are 2 to 6 years old. And then when families come in, we're doing a set of assessments that look at things like autistic traits, developmental level, language. We also collect information about things like medical history. And then we also do an MRI. So as Dr. Nordahl's talked about looking at these brain differences, we do a brain MRI, and we do our MRIs without sedation. So we do them at night during natural sleep. And we have this really amazing protocol that actually Dr. Nordahl helped develop that we kind of across this family of studies, Autism Phenome Project, GAIN, we've scanned over 500 children at night while they're sleeping. We have about a 90% success rate. So it's really fantastic. And so for involvement, we also though want participation to be as easy as possible for families. So we know that there are going to be families who want to participate who have working parents, who have busy lives. So we do try to work closely with families to schedule as best as possible around those busy lives. We have online components so that some things can be done from home. And we do things like we have mileage reimbursements for families driving to and from the Mind Institute. So we really want to make sure that we don't have kind of barriers. So anyone who wants to participate, who has a child, who has a girl, autism or non-autistic, ages 2 to 6, we would like them all to come in. We'd like to see everyone.
And we are posting in the comments the site to learn more about GAIN. We've also posted a link to a video that we recently did that features Dr. Nordahl about the Autism Phenome Project, if you're interested in just learning more about that as well. And I would like to just briefly, if you don't mind, Dr. Nordahl, talk about this amazing, the fact that you're doing MRIs on really young children without sedation. Can you talk about how you do that and why it's important that you're not using sedation?
Sure. So we, from the very beginning, wanted to study young children close in time to when they're getting a diagnosis, knowing that if we study brain development in older individuals, they've gotten further from their diagnosis and their brain is changing and developing. And so we want to look really at the neural basis of autism. We want to look as young as possible. A 2-year-old, though, whether or not they have autism, is not going to lie perfectly still for 30 minutes in an MRI scanner. And so the options are either sedate them or do it during sleep. And because we're a research study, we don't want to use any medications or sedatives. We wanted to do this as naturally as possible. We also know we want to repeat this over time. And so we're not going to subject a child to general anesthesia or sedatives at multiple times. And so we've worked really hard we work with the parents. They are our collaborators. They know their children the best. We do individualized plans for each child. to try to do the MRI scans at night. And it works most of the time. It doesn't work all of the time, but it's worked enough for us to get really good data on very young children to understand what their brains look like at these very early critical periods.
Yeah, it's really, really impressive. And I would expect comforting for families. We're talking with Dr. Christine Wu Nordahl and Dr. Brianna Heath about autism in girls and women. If you have any questions for our two experts, please leave them in the comments and we'll try to answer them toward the end of our discussion. Okay, this next question is a really big one. We could probably talk all day about it, but we'll give the highlights, which is what have you learned so far through the GAIN study? And we'll have each of you weigh in on that if you don't mind.
So I'm going to go ahead and start. And like you said, Marianne, this could be all day, but I won't take all day. I'll just highlight, we've been a few studies about the brain, and then I'll turn it over to Dr. Heath to talk about some of our other studies. But we basically, in every brain region and brain network that we've looked, we have found differences between autistic boys and girls. And most of these are in our early time points right now. So between ages of 2 to 5, we've looked at the rate of brain growth just across early development and found differences in boys and girls. There's a structure called the corpus callosum that's the largest white matter bundle in the brain that connects the two hemispheres. We've had multiple studies now showing sex differences in the corpus callosum. And then another region that I might just mention is the amygdala. It's a region that we've studied a lot in autism that's related to emotion regulation and threat detection. And we have seen differences again in early childhood across boys and girls with autism. We also are looking beyond these single regions at networks now to see, along with the amygdala, what other regions are different across boys and girls. And I think I'll stop there because otherwise I could go on for a long time. But Dr. Heath, do you want to talk about some of our other studies?
Yeah, just kind of briefly touching, some of our other interests have been looking at co-occurring conditions, especially things like psychiatric conditions like anxiety, as well as symptoms of ADHD. And we found that a higher proportion of young autistic girls show symptoms of things like anxiety and ADHD compared to autistic boys, and really indicates they need maybe more supports or closer evaluation when they're young.
So what is next for GAIN? It seems like there are more questions than you can answer in many years of research. What are you focusing on next?
So for our original GAIN cohort, the ones that we recruited between 2014 to 19, we would like to follow up with another longitudinal assessment during middle childhood, so 9 to 11 years of age roughly. And I think this is a really critical time point, both for brain development, as well as the emergence of co-occurring conditions like anxiety and ADHD. And it's important for brain development because brain size actually peaks. So it reaches maximal volume during this middle childhood, early adolescent phase. And there is evidence that girls and boys' brains are growing at different rates, both actually without autism as well as with autism. And so I think it's a really exciting time point from a brain perspective. And I'll let Dr. Heath talk a little bit more about why we want to study these co-occurring conditions at this age range.
Yeah, so we really want to get a better sense of kind of how frequently these are co-occurring, what are kind of maybe the different needs. As myself, someone who is female with ADHD and struggled to get a diagnosis, this is also something that's very near and dear to me, to try to see what we can do. ADHD is diagnosed less in girls overall, not just in autistic girls. And so if you think about it, we're having a harder time getting a diagnosis of autism, having a harder time getting a diagnosis of ADHD. Girls who have both are getting this kind of double whammy, not getting necessarily the supports that they need. And so if we can better understand how those conditions occur and what they look like, how they look different in autistic girls, then we can really ideally figure out ways that we can support them better and sooner.
Mm-hmm. And I would just add that, while we're looking for emergence of anxiety and ADHD at 9 to 11, we have all of that data that we've collected earlier on. So we can also go back and look for predictors of ADHD and anxiety, and perhaps intervene earlier to help support these girls before they reach a clinical diagnosis of ADHD or anxiety.
In your experience with GAIN families, are there specific challenges that autistic girls and women face that are different from their male counterparts? And you just mentioned one, which may be difficulty in getting diagnosis, but are there others that that you've heard from participants in this study?
Yeah, I'm going to take that one as well, because I've known some of these participants for a long time now. And so I've gotten to know these families, and, and talking to some original APP and GAIN families, what's been coming out from parents is that their autistic girls, it feels like they're either forgotten or just sort of lightly acknowledged, is what one mother told me. When they join social support groups for autistic kids, often those groups are dominated by autistic males. And so the activities are all planned around what boys like to do, not necessarily what girls like to do. And therefore, their daughters drop out of these groups. They're not participating, they're not being supported. And that's really something that's really hit home to me in terms of, is there something that we could be doing to be helping these girls now, rather than waiting for the results of the GAIN study going on. And so I'll let you.
Yeah, and speaking of which, I know that there is something that you are doing at the Mind Institute to help both of you. I know I've been involved in the creation of a pretty new support group called NeuroTeens, designed to allow autistic girls and non-binary teens to connect with peers. So tell me about NeuroTeens and how it works. Dr. Heath?
So we actually, I think we're almost close to a year on this. It seems like we just started.
It does. It's been a year.
We've run several sessions now. We're doing these in kind of 6-week sessions. And this is really a social support group for autistic girls and non-binary teens. So it is not a therapy. It's not social skills class. It's really a place for them to connect, find other kids who are like them. And it was really critical to us, not just to have a space for autistic, like assigned female at birth, but anyone who is basically not fitting into that box of the existing groups of, autistic boys. And so kind of expanding that to be more inclusive there. And we have really had an amazing group of kids come through. We do, some sessions are, some of us talk on a topic or kind of give a little bit of information for them, as well as opportunities for them to just socialize. One of the sessions that I do is about neurodiversity. And one of the questions that I ask of the kids is, what is their favorite part about the way that their brain works that's different from other people? And that is my favorite thing to hear. They have amazing answers. It's really nice to have this opportunity for them not to be focusing on how they are different from other kids, or viewing it as something negative, but what are the ways that their brain works differently that makes them them, and what makes them someone great. So we're really enjoying running it.
Yeah, we will post in the comments, if we haven't already, the link to NeuroTeens. As I understand it, you are going to be starting a new session here pretty quickly, right? So people can still sign up. We'll also post in the link, a link in the comments to a story that we did about NeuroTeens, where we spoke with one of the participants who just loved taking part, and I think has taken part in all of them so far. Anything you wanted to add about NeuroTeens, Dr. Nordahl?
I would just add that, this was sort of a spontaneous thing that my lab and I did, but I think it's really turned into something that's been meaningful, both for the teens, but also for our team of facilitators. So Dr. Heath and a number of other wonderful coordinators here at the Mind Institute are the leaders of NeuroTeens. And it's brought us together. It's brought us together with the teens. We've learned a lot from the teens. They are amazing human beings. And so it's just been a lot of fun, I would say.
Yeah, it seems like a really special group of people.
It's a lot more fun than, say, going and being in an MRI scan for 45 minutes. So.
And both are very important.
Both are, the MRI scan is very important, but yeah.
All right, we're going to be wrapping up shortly. So last chance, if you have any questions for our experts, please put them in the comments. Okay, so I think it's appropriate to ask for your advice, given your expertise in these areas. So for parents of autistic girls and women, what are your thoughts on the best way to support them, given the challenges that we've just talked about? Maybe start with you, Dr. Heath.
Yeah. So I think in thinking of this, really looking at this concept of neurodiversity and the ways that everyone's brain works in a different way. And so I don't necessarily have general advice of how to support every single person, but recognizing that if you're supporting your child, really digging into what are the unique ways that their brain works, and how can you support both their needs and their strengths too, and not just looking at what's termed deficits, but really what are their strengths and how can you play to those, and how can you support them in engaging in things using those strengths.
Dr. Nordahl?
So I don't know that I'm qualified to be giving advice, but I will just tell parents of autistic girls that your girls are not alone, and you are not alone either. There are researchers actively working on trying to find better ways to support your girls. There is a community of autistic women waiting for them. And hopefully we can put a link to our Summer Institute panel from a couple years ago. There's some very inspiring stories of autistic college grads and women there. And there's a growing number of female specific resources like NeuroTeens, like support groups for older women on the spectrum that are emerging. And so, yeah, that would be my advice, is just know that you're not alone.
Yeah, great advice. And please do check out the links in the comments. The talk that Dr. Nordahl just referenced is wonderful. She gave a talk about camouflaging. There's some real first-person experiences from women. There's one about ADHD and autism. We have one in Spanish as well. A bunch of really great resources, as well as the GAIN page. That's the study link, and about NeuroTeens if you're interested in signing up. So all of that is in the comments. Please feel free to check it out. And please feel free to share this with anyone that you think might enjoy it. And thank you both so much, Dr. Nordahl and Dr. Heath, for being with us today. We so appreciate your time and your expertise.